Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, and here from the JWC studio, today I've got a very dynamic guest. I've got one of the leading orthopedic surgeons here in Pune and the area. I've got Dr. Ashish Arbat. Thank you so much for being here, Doc.
Hi.
More important, though, I would say that more than anything, you're a very good friend. So thank you for being here. And I look forward to being able to talk to you about a whole lot of things today about hips, knees, robotics, myths, everything that we can talk about for orthopedics. I'm looking forward to that. So thank you so much for being here and welcome to the show.
Thank you, Kavas. And I would say it's a fine initiative. You're taking out time and because this means a lot. You guys taking interest in our fields
Absolutely.
and such podcasts, I guess, are very important because we need to see the other side of the hard work that goes behind building such a beautiful center, such good wellness centers.
Yeah.
And I guess very nice initiative.
Thank you. I mean, what we want to do is to have people be able to understand complicated medical things in a hopefully simple way and to give people advice, helpful tips and things like that for everyday life. So in that sense, actually it brings up my first question pretty well, in that you're an orthopedic surgeon, so I'm sure you see so many you've got vast experience in the patients that you've seen. What are the most common things that people come to you with?
Kavas, we have now focusing on all the branches are focusing on particular areas. So we focus on the hips and the knees.
Right.
And there are traumatologists and so now the most common things that we are seeing post-COVID is the avascular necrosis of the hips.
What does that mean? It's a big word.
Yeah, it's a big word. It's the hips are destroyed.
Wow.
And sadly, we are seeing this in younger population, males. 90% patients are males, and it is a tragedy that in the second wave of COVID, 60 lakh people reported with this disease.
Wow. Well, why is that happening?
It is initially we thought it was the steroids,
Right.
might be remdesivir. As papers progressed and
Yeah.
the world has near about 4 CR population having this. It's a huge problem in the Europe. Hip replacement started coming up and
Right.
we started studying. It is because of the virus itself.
Wow.
And after the second wave, early vaccines. So why males, we don't know. But all are in the working group, the ambition group. And it is realized very late. They come to us at a very late stage where we have to replace them in,
That's
very early
scary
age.
that has to happen for young people to have a hip
Age
replacement.
group is from 19 to 50.
Wow. Because you always associate hip replacement with, someone who's 70 plus or 80 plus or whatever it is.
Alcoholics or steroid guys.
Right. That's pretty scary.
That is one thing we are seeing a lot. And of course, osteoarthritis in the old people.
Yeah.
But that is pretty common
Yeah.
in 128 countries.
Right.
But avian is,
But you're saying it comes pretty late to you. So what are the kind of early signs that people can look out for?
it's a good question. I've been talking about this a lot. The early signs is, first of all, if you have an history of COVID,
Okay.
or exposure to COVID, I have seen people taking home quarantine and all, not big symptoms. But if you have been anywhere around the COVID or a vaccinated person, a second booster dose or something, and you have more than 15 days of hip pain,
Discomfort of hip pain. Okay.
discomfort. What
Right.
kind of pain? Continuous pain, not responding to your regular off-the-shelf NSAIDs, and
What is NSH?
the painkillers.
Okay. Yeah.
Yeah. And they go to the local GP.
Right.
But if it's more than a week or 2 weeks, you should be
Checked out.
You should check out. And the symptoms are some people have pain, but commonest symptom is it is continuous.
For a
While
long
sitting,
period of time.
even during sleep, that discomfort.
Okay.
They cannot sit for long. See, normally what we feel, I've had sports or long travel but you'll have during the rest period also. So that is one point that people should realize, that if it is more than 2 weeks,
Yeah.
you need to see a specialist.
And then what are the options available? Is it, I mean, it can be treated
yeah.
or is it like, does it have to be surgery? Or?
If they come early.
Yeah.
So what happens is we have grading from grade 1 to 4.
Yeah.
It is no brainer that grade 1 would be the earliest. See what happens. Every mobile joint is covered with a layer known as the cartilage.
Yeah.
When the cartilage is good and when the cartilage is bad.
Yeah.
The broader
Right.
spectrum.
Right.
If the cartilage is good, we have some medicines and offloading them. There are certain hormones that are available. So in Jahangir, we have started avian clinics.
Okay.
So we see these patients early. Those who see these kind of programs, they understand, they come early. If they come in stage 2 kind of stuff where the cartilage is good, the bone is a bit destroyed. What happens in avian is the bone starts to get destroyed, the soft bone, and the head collapses.
Right.
And then ultimately you have to get replaced.
Okay.
There are certain stem cells therapies known as regrow osgrow therapy.
Right.
So we give certain stem cells which are cultured. Luckily, those factories are in Pune.
Oh, okay.
Yeah.
So
And Jahangir is one center which does it in the cheapest rate
right.
compared to the whole state.
Okay. And this is what, like, it's like an injection.
It's a process
that's simplifying it, but
small surgery, which is a percutaneous procedure,
Okay.
but kind of an injection,
right.
where we take stem cells, send it to the lab, get the bone-forming cells known as osteoblast, and inject them.
Okay.
So we have presented in UK more than 1100 successful cases of this therapy pan-India. Out of them, 500 successful are from Jahangir and
Okay.
done by me.
Right.
What happens is when they don't realize this and they come late by certain means, then we have to talk about what we are going to talk about, replacements or something.
Right. Right.
But these therapies are available, but catching them early is what we look for.
So what are some of the preventative things that we can do?
Sadly, there is nothing prevention because it's a disease.
Right. Or maybe for this particular thing in particular, but for regular hip replacements that that in historically that you've seen.
Historically,
what are the things that people can do to delay that as much as possible or avoid that?
Alcohol. Alcohol is one of the biggest causative factor of avian. The Europe has seen it a lot, and there's a reason the Western world has a lot of hip replacement because of the volume of alcohol. It's more than 180 ml per day.
That's a lot.
That's a lot.
That's quite a bit. Yeah.
Yeah, but people are. And smoking, tobacco products, long sitting.
That's a big lifestyle
Big
problem.
lifestyle problem. And those people have these issues. And now certain drugs. But see, sadly, people who take steroids for certain diseases, so they have like rheumatoids,
Yeah.
tuberculotic patients,
Right.
and chemo. We have seen avian in the chemo group, cancer patients. But come on, they were initially, but post-COVID, the whole scenario has suddenly gone
Interesting.
very bad.
A little scary also.
It's scary. It is because all are very young subjects.
Yeah, exactly. That's what the scary part. Because I always, as I said, associate hip replacements with
Even during our residency, when we used to learn, avian was like, come on, a old guy coming, history of alcohol or some accident.
right.
Here, patient is shocked. He's not ready to accept that he has just come out from one big disease and going into some other disease.
Right.
Sad.
What about nutrition, exercise?
Sadly, these, especially for the hips, we have tried collagens, nutrition, offloading. Yes, offloading is one thing.
What does that mean?
The offload is to get off the pressure of the hip. See, not sitting in one place for more than 2 hours.
Okay.
If you have a hip pain and you're diagnosed with avian, example, grade 1, we give them crutches for 3 months so that you offload. There is something called hoop pressures that the tires get.
Right.
Similarly on the hips. So what happens, I have seen people sitting 16 hours, 12 hours, at least 8 hours in front of the computer.
Wow.
Immobility, you stand up for after an hour, if you're long flights, walk, and prevent alcohol.
That's a big one.
Big one. And people who are addicted to some painkillers, they have
Opioids, right.
So those are very small group, but history of COVID, 15 days symptoms.
But for a regular person, I suppose alcohol is the one thing that you're pointing to. Fair enough.
Alcohol.
So let's shift gears a little bit. We're talking about orthopedics. You're a pioneer in the field, especially now as we're getting into the world of robotics. Everyone is talking about robotics, especially in the orthopedic field. What is it exactly? I mean, it's people have been using this word as a buzzword today. Whether it's, is it a fad? Is it actually here to stay? There are many questions I'll ask, but maybe I'll just start by asking what is in your mind as a pioneer today, as someone who does use robotics, what is a good use of robotics today?
So I put it, very nice but a very broad question.
Yeah.
What happens is, likes of James Cameron, we feel robo is like some
Right.
android coming down and doing a surgery. It's not that way. First of all, robos are like our GPS system. They or some gadgets in a car. Or say if you are a F1 rider and it's some design of your car or
So
some.
it's there to aid you.
It is a second assistant.
Yeah.
The things that we couldn't quantify. So example, if we give, say the knee replacement, the dimensions of the knee, pre-operative,
Okay.
intraoperative, to measure them, quantify them in mathematics.
Right.
And that's where robots help us.
I see.
So like if I have to do a 3-degree correction, I wouldn't know with my bare eyes
Okay.
whether it is 3 degrees. So initially it started with navigation. So to get these angles, why? Increase the longevity of the implant because it's a foreign thing.
Yeah.
Decrease the coefficient of friction. A lot of engineering here.
Right.
And of course, giving the best fit. So
What
robots
does that mean?
say like this your knee size 1. I have no means of knowing that pre-operative that I have to go for this particular implant.
Got it.
Now AI helps us to decide, say out of 13 different companies, which is the best fit.
Right.
I give an analogy to my patients. Like say Merc is a very nice, it's a sports car, or Beamer is a sports car,
Right.
but it won't work on a bad road. The person would be happy in an SUV.
Yeah.
So if
And the driver needs to be good.
driver needs, so we drive it. So no robo does a surgery.
Yeah.
They are not allowed. They don't. The machine learning is still not.
So it's not autonomous.
It is not
what people
autonomous.
think of robotics as.
No. So it's like you asked the second part of the question, is it here to stay?
Absolutely.
Definitely stay. Might be takeover, but
I was going to ask that question at some point. It's a
it's a long
question.
time because what one more we have seeing is machine learning is very slow. As everyone knows, very very slow. It feeds on the data that we give them. So it's under our control. Where it helps us is quantification, preciseness, pre-operative planning, which we were not exposed to. So it's like music. It's very harmonious now because we are so sure about what we are doing.
Yeah.
In terms of the engineering part, how much correction is needed. So, what happens in arthritis or
Right.
hip issues, they get shortening. I don't know how much he's shortened. So, the AI compares. Now, what we do here is we do CT scans to compare the normal side
Right.
or the ethnicity of the patient, decide preoperative what size of the implant, what best fit, and the robots help us in getting those angles which are pre-planned.
Okay. So you don't personally, as a doctor, view robotics as a threat. You think
Not
it's
at all.
something that helps you and can enhance your practice, actually.
Actually, I'm biased on that side because we're doing it for the last maybe 10 years.
Right.
Yes, there will be group of naysayers because change is one thing which humans have always deterred from.
Right.
Anything, somebody sold a bottle of water and they
Yeah.
now
Which is why you're a pioneer in this field, because you've accepted it that way.
what we feel is the devil or the god is in the details. So it is very detailing. So I normally compare it to the car world.
Yeah.
So one small change from Merc to McLaren gave it what edge? It's just those side wings.
Yeah.
And who knows? And they are unbeatable.
Yeah.
These kind of stuff. So what is happening? We have a lot of data. We can design a lot of implants.
Right.
It is helping in a lot of fields. And it is taking us to the other level, definitely in terms of designing.
Yeah.
Giving every patient a different design. So 3D printing is also in a way, and the robo understands
Yeah.
a lot of stuff there where it assists it's like a computer. It's like an Excel sheet example. So you can have 4 Excel sheets working. We couldn't do that long back.
Right.
It is definitely. I am on the other side.
Absolutely. Which is why
Yeah.
wanted to have this conversation with you. Because
So
as you said,
robos for common man, we are talking here. They don't do the surgery. They definitely help us, like the GPS or a pilot. More than the GPS, like a pilot landing your aircraft,
Right.
and he gets the autopilot with him. How much is the distance and where is the runway and
Right.
all that stuff. So he can land it
Right.
better than what he could, or a
Absolutely.
missile going somewhere. That kind of stuff. So robos are definitely here to stay. Definitely helping us. But again, Cameron has given a very different idea of a Terminator.
Yeah, exactly.
It's not that way.
Which is comes to my next question is really that the layman, or rather, today everyone is marketing robotics in hospitals and so forth. What should someone look out for in terms of what is actually robotics and what is not robotics? Like, for example, we at Jahangir now have got cutting edge
Again,
proper robotics.
What
So
we like
what
about
should
Jahangir
people
Kaiwas
look
is
out for?
when we had a lot of meetings. What I liked about Jahangir and what I love about is the grace that they put in everything.
Right.
You guys never asked us this or that. So which is the best?
Right.
The only question asked by so best is in every terms. And what we got is one of the best robos. What is the best robo? So it should encompass everything: the shoulder, the hips, the knees. One more thing, it should be well experienced.
Right.
So this particular robo that we got, it's a second generation. So it's the oldest design,
Right.
which is modified over time.
Right.
It has a haptic arm, which assists the surgeon.
Okay.
So you have a mechanical.
While you're there.
Other robos, none other companies have that. This is CT based, so the planning is very precise. There are planners for each machine by the company. None of the other companies have that. Third thing, the haptic arm is the best in the world, and its haptic arm is what the arm comes down. Or the Terminator has a hand.
Yeah.
There's no haptic arm.
Donate. Okay.
So it's a common analogy. People know it. So the robotic arm.
Right.
This is the most sophisticated robotic arm because either other robos are just a navigation machine with the arm, which you have to just guide and look. This arm is haptic.
Right.
Haptic in sense it senses your touch, your planning, or otherwise it is totally automated in some
Right.
machines where you're just no control.
Wow. Okay.
So this is the best of both the worlds.
Understood.
So if I have to stop, it stops. It just feels it is coordinating.
Right.
So that is one thing, and one more thing is quantification of every small
Now you mentioned, yeah.
which was impossible. Imagine going back of the knee,
Wow.
saving the bone,
Right.
fitting the best implant. Now you in the hips, especially I love hips, and I think I'm the Jahangir has blessed me with highest number of hips right
Yeah.
now.
Well, they don't lie.
Yeah, of course. Anything they can do, but not this. Yeah. So
Yeah.
it's not corporate.
Right. Well, let me ask.
Very-
Oh, I'm sorry. You were talking
So
about that.
hips.
So.
This is the only machine
Right.
that has hips.
Oh, really? Okay.
And what happens, Kavas, in hips is unlike the knees, which is in 2 dimension, hip is in 4 dimension.
4 dimensions. What's the fourth dimension?
Fourth is the rotation.
Oh, I see. Okay.
So if you look at a hip, for an engineer, hip is not straight. It is
yeah.
4 dimensions.
Okay.
So if I feel I'm doing a hip and I feel it is good, I'm left-handed, I might feel good from this side. A right-handed surgeon might feel it. Here's a robo. The planning is so perfect. So tomorrow, if my co-assistant or junior is assisting and he looks at the robo, it's going in the angle that is planned.
Right.
And Mako is the only machine that implants the implant itself,
Wow.
planned by us and assist us. No other machine.
So effectively, what you're saying is you're just taking error out of the equation.
Up to, they claim 98%.
Wow.
That's huge.
Yeah.
It's a huge statistical,
Incredible.
huge.
So final question on robos then. We've talked about, all the benefits it is for you as a user. How does it benefit me as a patient if I wanted to use it?
Yeah. So what does the patient look for us? So see, let us be in the kind side. What does he look? Doesn't want another surgery.
Yeah. Absolutely.
Wants to save as much as you can. Your soft tissues. And he should it's a world of choices now, Kavas.
Yeah.
So there's so many implants. How do I choose? So one doc says, see what happens, there are a lot of commercial angles to it and we cannot
Yeah.
deny it.
Right.
Somebody buys a particular robe and then
Right.
this is the best implant. But if you have plethora of, so there's a partial knee replacement. If AI tells me that this guy is good, the bone stock is nice for a partial, we can give them 7-8 options.
Right.
And that's what the patient wants. Now, at least for me, the first question now, when the junior doctor says, so this is defined avian and all, then the patient comes to us
Yeah.
for the final call. What do you want? This is the first question I ask. What do you want?
The patient you ask.
Yeah. So I play sports. I ride bikes. We allow them now. So
Let
this
them
is the
be
implant.
decision maker,
Yeah.
which is actually what you want. Yeah.
As you asked as a patient, right?
Yeah.
What I want. Like, I want to cycle, doc. Can I ride a bike after
Right.
this?
Right.
Initially, it was let's see.
Okay. Now you
whether
can
it
give
suits
more
him.
definite
Yeah,
answers.
More definite answers. He wants to see what we are going to do. Pre-operative, everything is shown to him.
Right.
This is your implant. This is how the surgery is going to be. Imagine, he knows. So acceptance is better. Physiotherapy. So everything is better. See, you are so choosy about your clothes, choosy about your food. Why not what goes in for
Absolutely.
life?
Yeah. It's huge.
And from our side, saving the muscles, saving the blood loss, giving more natural. So we are also using it for research. Oh, this implant failed XYZ years back.
Yeah.
Can I have a better design? Understanding human anatomy more. So yeah, I think big propagator of robotics.
No, that's exactly
the
what we
company is not giving me anything on that, but yeah.
But that's what we wanted to talk
Tech
about.
is here to stay. I guess everybody will agree on that.
Absolutely. Well, it's been fascinating talking to you about this and the future with you at the driver's seat, Doc. So thank you
for
so
that.
much for being here. Any last words you'd like to leave us with, particularly about Robo and the future?
I feel like you mentioned, people are using it for marketing.
Right.
We should not.
Yeah.
We should not jostle about the conventional. It is there to stay. We should be mature on it. Robo should be used when it is needed. What is happening is it is overused also sometimes when, see, there are cases where you can go with conventional.
Yeah.
In Jahangir, that we have decided that yes, there are a lot of deformities and a lot of angles that need to be corrected. We are going to be mature in not using Robo as a gimmick.
No, it's like you said, we're empowering the
We are
person
empowering
to take their own choice.
And when we can do conventional, we'll be doing conventional.
Absolutely.
But for hips, definitely I might tell my juniors and this, for the hips, robotics is better than the conventional. So definitely when the hips come, I would give the patient an option that knees fine, conventional and they stand
Yeah.
a bit together.
Right.
But for the hips, robotics has taken it in a different, because it's 4D. Our brains are not. You won't believe. I have specs, and the person who doesn't have specs has a 13-degree error inbuilt if
Right.
he's a sapien. So you have to be sapien to be on 10 degrees. But that's 10 degrees I'm going to recreate how good human being I am.
So now I talk about being cyborgs.
Cyborg. So
That's the next
I guess hips, yeah, and even for the shoulders when it's come, it would be good because these joints are very complex
Yeah,
joints.
absolutely. And most common for this kind of stuff. Well, thank you so much for being here, Doc. It's been absolutely insightful hearing from you and look forward to the future with you.
And I think we should have a couple of more.
Oh, yeah. I mean, we could keep going on and on, but then we'll
might
be
be
here.
cover the knees and then, once we start. And thank you, Gavas, and always been a pleasure.
Thank you. Thank you so much, Doc.
Thank you.
Thank you all, and we'll see you next week for next week's episode. But before you leave, do not forget to hit the like and subscribe button here at the bottom. Thank you.